Hi, everyone. My name is Keith Vinci, and I am the Director of the Geographic Health Equity Alliance. We have been working with the Iowa Department of Public Health over this webinar series. This is the last webinar of the three-part series. So today, I just want to give you a little quick recap. This webinar series was created as a result of an agreement reached and partnership developed by our national network, the Geographic Health Equity Alliance, and the Iowa Department of Public Health's Division of Tobacco Use Prevention and Control. Our team and I have been working extensively with one of our parent organization's Master Coalition trainers, Dave Chevelle, who has been providing technical assistance throughout the entire series. So what I'm going to do right now is hand the presentation over to Dave, and he's going to start with a recap of webinars 1 and 2, and then lead us into the discussion of the last and final webinar, webinar 3. Dave?
Great. Thank you, Keith, and good day to everybody. Welcome to the third of our webinar series. And I did my welcome from beautiful Portland, Oregon, and it's a beautiful day here, and I hope you're having a beautiful day wherever you are. And again, as Keith has mentioned, this is our third webinar in the series. The goal of these webinars overall is to provide you as coalitions, as coalition partners in doing your work in tobacco control. And so what we want to do is to support your efforts to help achieve your goal 4 of your annual work plans, which is really that coalition development and how you can continue to work with your coalitions, work with your partners in addressing tobacco within your communities. And as Keith mentioned, this is the third webinar in our series. The first webinar we talked about really how we build strong coalitions and engage coalition partners. The second webinar is where we talked about how we can look at our communities to understand that community environment in which young people and which adults choose to use tobacco, and how does the environment support those that do not choose to use tobacco. And so we really looked at that community assessment, and then that information, and we will provide a bit of a recap as we go through today's webinar. That leads us to our third section here today, where we're really talking about how we use this information about building a strong coalition and partnerships and the information we've collected from our community assessment to really move to action, which means planning and implementing comprehensive strategies. And so just for your information, this is a little bit more about Keith and myself. I have been training now with CADCA, the Community Anti-Drug Coalitions of America, with coalitions through their National Coalition Academy, where coalitions are spending 3 weeks over the course of a year walking through this entire process of building strong coalitions, of looking at their communities, walking through a planning process that moves them to action. So I've been providing that sort of trainings to coalitions throughout the country that are addressing alcohol, tobacco, and other drugs as well. So we welcome you to our webinar today. And just as we've been talking about the overview of today's session, we will be building on the previous 3 sessions, which are recorded. So I encourage you to go back and look at those other ones and see how they can play into building toward moving to action, which is what we're talking about today. So session 1 was really talking about building capacities and partnerships. Session 2 was assessment. And then today is we're walking through session 3. And if you are looking at the circle, this may be familiar to some of you. This is what SAMHSA, the Substance Abuse and Mental Health Services Administration, is what they call their strategic prevention framework. A lot of communities and coalitions call it their planning process, but really it's the framework that SAMHSA uses so that for all the grant recipients can use a common language. And it's in addition to assessment capacity planning, there's implementation, and we evaluate our efforts. And we do all this with cultural competence in mind, making sure we're reflecting the diversity of our community, and also with the goal of building sustainability, because we know community change takes time, and we want to make sure we're able to sustain the efforts long enough to achieve those community-level changes. The other thing, as we go through this webinar, we encourage you to pause as needed to reflect on these materials, to look at some of the handouts that are provided with the webinar, and I'll mention some times where it will be helpful to pause as well. So just an overview of today's session. What we will be talking about As I mentioned, we are moving from the community assessment, which we did talk about in session 2, and how we move from the community assessment into moving what we call problem analysis, which is really how we can look at that assessment in a critical lens to be able to say, based on what we've learned about our community, what are some of the areas we need to focus on? What are some of those local conditions that we really want to put our efforts toward? And then we can use that to build a logic model, which is a roadmap. That logic model allows us to identify specific local conditions with which we use to develop our comprehensive strategies, which allows us to move to action. So we're talking about this process over the course of this webinar. And so just as a review, just the community assessment, which we did talk about in session 2, there are 5 parts. We're not going to go through all these as part of our review, but it is important to understand that we need to describe our community, and that tells us, are we a county-wide? Are we trying to impact change through a county-wide effort? Is it a city-wide effort? Is it a neighborhood? Is it a multiple county effort? Is it a statewide effort? Because when we talk about community-level change, that's the target audience for our effort for our strategies. Community history allows us to understand what has happened in the past to make sure we don't repeat it. We give people credit. We learn from our lessons. We'll spend a little bit of time talking about needs assessment and resource assessment, which is where we really understand what are the issues in our community. And we're not starting from scratch. There's already a lot of strategies, a lot of actions going on in our community. So what are those resources which allow us to identify our priorities or our problem statement? So what we're going to do is just, as I mentioned, walk through a little bit of time walking through the needs assessment portion of this. And the needs assessment is where we really understand what are the conditions in our community. And we start by looking at consequences and problems. So this is what people tend to see. The consequences are a lot of the health issues, the financial issues. The problem is how many people are smoking, how much are they smoking. When we think about underage smoking, when are you starting to smoke? What are those conditions that lead to young people starting to engage in using tobacco in, and we say smoking, but in any form of tobacco use? What are some of those conditions that are facilitating young people to becoming involved to start using that tobacco? The root causes and the local conditions are really when we look at what is happening in our community. We know even within a state, there are different counties. Within the counties, there are different communities. And even in communities, there are different neighborhoods where those conditions are different. And we need to understand those and look at those conditions to allow us to target our strategies. So delving a little bit more, and we'll look at disparities as a way of looking at that data to start to say how are these conditions different across our communities and across different populations within our communities. So again, just an example, when we look at youth tobacco, or what we call root causes, some people call them risk factors or intervening variables, but these are the conditions that exist in a community that will encourage young people or provide young people with a greater opportunity to become involved in tobacco use in this case. And when you do look at the research on risk factors, there's a lot of conditions. We've identified these root causes as those root causes that lead us to environmental strategies. And environmental strategies, which we'll talk about in a bit, are those strategies where we're able to impact the entire environment, so such as using policies or changing overall procedures or systems within our community. So when we look at retail availability, where are youth getting their tobacco products from retail establishments, or are they getting them from social availability? That would be getting them from friends or family or non-retail establishments. Community norms are, what is the community's attitude? Are there places in the community where young people may see adults smoking, where it's legally outside the bounds of outside buildings or in certain locations? At certain events, is there smoking that's allowed at those events? The laws and enforcement are saying, are laws in place that prohibit smoking in certain places? Are those and prohibit young people from having access to tobacco? Are those laws enforced? And if they are enforced, are they followed up upon? What are some of the consequences that are provided? Price and promotion has to do with, obviously, how much advertisements do we see in our community promoting tobacco products? And where are those advertisements? And how much are those either directly or indirectly targeting young people with those advertisements? Price typically is something that we affect through taxation, which may vary at the state or at the community level, but it's really, we know clearly that if we raise the price of a commodity, of a product, demand goes down, consumption goes down. So as much as we can try to influence price. Then finally, whether it's parental attitudes or youth attitudes, do they see the harm in this case, using tobacco products? Do they see the risks associated with it? And we know that when the risk drop, when risk associated with harm drops, then we see youth increases. And we've seen this around marijuana with the legalization and the promotion of medical marijuana. We've seen perceptions of marijuana harmfulness go down, which means young people are more likely to try it and use it. And we know with tobacco that there are some clear documents around the harmfulness, but despite that, some young people are still using tobacco products. So we want to know how they're getting their information about tobacco and how they're making decisions about perception of harm. So these are critical because when we start to target our strategies, we don't want to just target tobacco use, really target our strategies around these root causes. And we'll even talk more detailed description of these root causes, which we call local conditions. So again, if you're looking at your community assessments, this would be a good time to start to look at what are our assessments saying around these particular root causes or risk factors or intervening variables. And just as an example, this is for Iowa from the counter to the wonderful mapping process that's available online. Is you can start to see, this is just looking at one aspect of the root causes of availability in communities across the country, and you can see, are we doing compliance checks and how many retailers are failing those compliance checks? So if we have a community that, if you look at these dots that are mostly green, that means that of those retailers that were checked, there is compliance, that those retailers did pass the compliance checks, which means that if we focused our strategy on those retailers, we're not going to really make a dent on tobacco use because they're not selling to minors. So this tells us just one piece of information as an example of how we can look at those root causes, those risk factors. Just another example when we look at disparities, which again allows us to target our strategies. In this example, if you see there's two sets of data here. The data in the front is data from, and this is national data, but it gives us some information looking at the urban communities where we see the tobacco use by different age groups in brown. Rural communities are in the back in the red, salmon colored. And this is looking at smokeless tobacco use, and it's as we might expect, but smokeless tobacco use is more than double the use in rural areas as it is in urban areas. This tells us, and you can look at the age difference when people are starting. They're starting as early as age 12 to 17 with their higher levels of smokeless tobacco use. So again, if we want to target strategies, we can find out what types of tobacco products are being used, where in our communities, by whom. That allows us to target our strategies even more targeted once we have the information like this. This is just two examples of how we use data to drive our strategies, our planning efforts. And so just to summarize, we talked about in the assessment 2 webinar that we did, there's different data collection. We look at qualitative data. We look at quantitative data. You can see examples here. We can do surveys. We can look at existing data from law enforcement, from health departments, and we can look at qualitative data, which is talking to people, focus groups, observation, listening sessions. So this is where we're looking at a variety of data. When we look at those root causes, there's not one piece of data that tells us about social availability. There's not one piece of data that tells us about are laws in place, are laws enforced, are they followed up upon, are there consequences, are youth aware of if they're smoking in public places, or do they even perceive that they'll be caught by local law enforcement? So again, there's not one piece of data. We want to look at multiple pieces of data. And again, this is just an example. If we want to find out where youth are getting their tobacco, so the availability of tobacco products, we can look at compliance checks under the archival data. We look at reward and reminder, whether informal forms of doing compliance checks, police reports. We can look at surveys of parents and youth. and the community surveys, and we can talk to people. Again, when we look at real specific information around each of the root causes, we really can get an understanding of, is this root cause a problem in our community? And again, the reason why we're reviewing this, because this data are so important, because they drive our decisions about where we're going to prioritize and target our strategies. And so that's the needs assessment. The resource assessment piece is critical to planning because it tells us what is already happening in our community, what are existing resources, what types of education programs are out there, what type of responsible beverage tobacco server training or tobacco or training is provided to our retailers. And, for example, what type of curriculum are youth hearing in our schools around drug use, around tobacco use. We really want to understand what's happening because this is important for developing strategies. And I'm turning to the next slide, which talks about some examples of resources. When we know what's already happening, it allows us to support those that are making a difference and really strengthen and find maybe gaps in some of these sorts of resources so we can really make sure that we are addressing those priorities that we've identified within our community. Finally, this allows us to pull together a community assessment report. And the community assessment report is critical in several reasons. One, it summarizes all our effort, and it allows us to build awareness of the issue in our community. We can share targeted information we can pull from the report to share to community leaders if we're going to be moving toward putting in new policies in place or asking to follow up on existing policies. Community leaders need to know about what are the problems related to tobacco. Our partners, whether it's the health department, whether it's family service providers, the schools, law enforcement, they need to know that we know as a coalition, as an organization moving forward on this, how we know what the problems are. What data do we have that tells us that is social availability, that young people are getting their tobacco from these specific sources. And also for the community as a whole, if we're asking the community to support us in these efforts, there's a lot of issues in our community. There's a lot of emphasis now on opioids and overdoses, and underage drinking is still a problem, and a lot of other social issues. If we're going to ask people to focus on tobacco, which we know is a problem in our community and has long-term consequences in our community, then we need to provide data to them. The community assessment report is a real nice way of pulling that data together so that we can share in appropriate formats with key segments of our community. So with that summary of community assessment and the necessity of conducting a good assessment in order to develop strategies, now we can move to the next part of this, which is our planning efforts and how we're going to take this community assessment information and really identify what are the strategies we want to put in place in our community. And so, as I mentioned earlier, the next step in this process is to really start to understand and tease apart this community assessment data so we can understand it in a way that allows us to identify our strategies. And we call this the Shrek or the ogre portion of our training. And if you remember the movie Shrek, and when he characterizes what it's like to be an ogre, he said an ogre is like an onion, that you have to peel back the layers in order to understand it. Well, it's the same thing with understanding a problem. We have to peel back the layers of the tobacco use problem and understand what are those root causes, what are those local conditions. And so the problem analysis allows us to do that, and we can do that in a way where we're going to walk quickly through a process, but we can do quick sessions around this with groups of people. If we've got 20 minutes with the PTA, or we've got a group of young people, or we've got a meeting with members of our Chamber of Commerce or law enforcement. We could go through this, provide them with data, and then get their impressions about what does this tobacco look like in our community. So let's walk through this and see how this can be used as a way of really furthering our understanding, peeling back the layers of a given problem. So when we do our problem analysis, the first way we start with our problem statement, and it's based on our community assessment. Moving to the next slide here, the problem that we're talking about here is underage tobacco use, as an example. It can be any other problem. It can be underage drinking. It can be use of overdose of opioids. It can be obesity. It can be homelessness. There's any number of problems we can identify. In our case here, we're going to use underage tobacco use. Then we simply ask the question, but why? Why does that exist here? And here's where we use the data on our root causes or our risk factors, and it's based on our community data to say, okay, what do we know about availability? What do we know about laws and enforcement and community norms and favorable attitudes in price and promotion? So based on our data and after sharing with our community groups, whoever we're talking with, we can simply, and you can do this on a newsprint, you can do this in a variety of ways, but you ask them why, which of these root causes do you see, and based on data, you see as a problem in our community. And again, here's a summary of those root causes. Then they can say, okay, based on our experience, based on the data, these are the root causes that we see are the biggest. So I've just provided an example here of 4 root causes. And what this allows us, we're doing that focusing. We're peeling back layers, and we're narrowing down what is it we want to target. So then we can say, okay, of these 4, which ones we want to target, and before we can make that decision, we need to say, okay, these are still fairly generic. We want to know, but why here, meaning what do they look like here in our community? So this takes us to the next level, and again, this is based on data we've collected and people's perceptions. What are these local conditions? What do these risk factors look like in our community? And so we really ask people to look at 3 characteristics of defining what this looks like by saying specific. Is it a behavior that we can look at? Can we take a picture of it? If your local condition we have adults smoking outside the hospital building, outside on the grounds, we can take a picture of that. If we say that youth are buying from retailers, we can take a picture of that. So is it specific? Is it identifiable? Meaning it happens often enough that we can count it, so that way we can measure it. And the last one, is it actionable? Is there something we can do something about, or something we think we can do something about? We may think tobacco prices are too low, but if our only avenue is to raise taxes at the state level, that may not be actionable for our community. A lot of times, not necessarily with tobacco, but with other drugs, they say, well, I-95 runs through our town, and there's a lot of drug traffic on I-95. We can't change the fact that I-95 is running through our town. What we can do, though, is we say that, well, at exit 32 on the corner of Main and 5th Street, that's where the drug trafficking occurs. We can target that particular area where those sales are occurring. So, again, we can't impact I-95. We can't impact a local condition within our community. So when you're working with a group of people, you can ask them, what are each of these root causes here, but why here? And then, so for each of them, you can get, and it's a brainstorming activity based on the data you've collected, you can start to say, what are those local conditions? So we can start to say, okay, social availability, meaning where are the non-retail sources? Youth are getting from friends at school. That's specific, identifiable, and actionable. We can actually see them sharing their tobacco at school. Others may be parents are providing at home. We know parents are providing their tobacco, or they're strangers at the mall who are either selling it to them, or they're just they bum their cigarettes off the strangers. So this is based on collecting data. This is, again, whoever group you're working with, these are what they've identified. But now we're getting it to places where we can start to, and we'll talk about prioritizing, to start to say, where do we want to make a difference? Where can we impact these particular local conditions? Just walking through other examples, you can see here favorable attitudes, meaning what are behaviors in the community that give young people the notion that it's okay to use drugs, that it's okay. What are some of the attitudes? So here's where parents smoke with their child. Again, that says, if you remember the old tobacco commercials, like father, like son, when parents engage in behavior, that gives you some information that may be acceptable to do that. They see staff smoking outside the school, or coaches are using chew at their games. So again, these don't mean to pick on anybody, these are just some examples that we see in working with communities. Finally, under laws and enforcement, this is about, again, are laws in place, are they enforced, and is it follow-up? So that, the police, they have a lot of things, local law enforcement has a lot of issues on their hands. Are they enforcing tobacco? Is that a priority for them? Or we know, or the school knows after school, behind the gym, the smoking occurs, there's limited enforcement there. or even at games, well, on school property, which are supposed to be drug smoke-free zones or tobacco-free zones, we still see adult smoking at these games. So that's an example, again, where we know there are laws, but they may not be enforced. We're not blaming law enforcement. We're just saying as a community, it hasn't been a high priority. And then finally, retail availability. Stores are not checking IDs, or youth are faking IDs, or related. There's a lot of paraphernalia on sale at various shops in town that can be used for tobacco and other products. So again, when that would fall under availability. So what you see here, when we look at our data, we get input from people, there may be a whole range of areas that we can focus on. But looking at these, if you notice, that what we've done is we peeled back the layers. If you look at the center, underage tobacco use, we pulled back the layers to say, okay, what are some of the root causes, and then what do those root causes look like in our community? Now we have some very specific places, some very specific behaviors where we can develop strategies. But first, again, just from this example, we have potentially, 4 times 3 is 12 different places where we can intervene. So what we need to do, we need to prioritize. And when we prioritize these conditions, then that allows us to build a logic model or a roadmap. And many of you may look at this, and there are different versions of a roadmap, but really what a logic model does, it documents our decisions, our perception of what does this problem look like in our community, and it provides a mechanism to really say if we address these specific conditions in our community, then that gives us confidence that we're going to have an impact on an ultimate problem. So again, there may be different formats to a logic model. They all, again, provide a roadmap for us for developing strategies. So looking at a logic model, the format that we use at CADCA, Community Anti-Drug Coalitions of America, is when we start, you can either go right to left or left to right. If we start going from left to right, we start with our problem. Then we say, okay, what are the reasons why that problem exists? What are those root causes? And then, but why here? What are those local conditions? What do the root causes look like in our community? If we go from right to left and looking at it from a strategy standpoint, if we impact our root causes, if we impact our local conditions, and we look at those specific local conditions, when we impact multiple local conditions, that'll have an impact on the root causes. When we have an impact on the root causes, over time, over the longer term, those will ultimately have an impact on the problem. So if we look at just how that plays out, what we want to do is move in order to develop that logic model from our problem analysis, which is our brainstorming based on data. We want to say which of these local conditions, which of these root causes do we want to focus on as a community. And so obviously these are all community decisions that are facilitated by the coalition, by your organization. So moving from the problem analysis to a logic model, we want to base it on data. We want to, whatever we target, whatever the local conditions, we want to make sure that there's data that tells us that is a problem. For instance, if we say that there are, as I mentioned earlier, retailers selling to minors, and we don't have data, it's just a perception, then if we find out that they are not selling to minors, we may put a whole lot of effort into addressing a condition that isn't a problem in our community. So we want to base our decisions on data. We want to make sure the local conditions, as I described earlier, are specific, identifiable, and actionable. We want to prioritize based on importance and changeability. And so importance and changeability has to do with important one is how much of this is a problem, how many people are impacted or affected by the problem. A way of looking at this is availability. Where are the primary sources youth are getting tobacco? If we find out, again, I keep going back to retail availability, if only 1 or 2 retailers are selling to minors in a larger community, that's not that important. There are other sources that are more important. Another way of looking at it is deciding between root causes. What's more important to take on the laws and the enforcement, or is it more important to take on the favorable latitudes, which, based on our understanding, which is having a bigger impact on the problem? And changeability has to do with actionable. Is this a root cause? Is this a local condition that we think we have the capacity, and we think we have the resources And looking at number 4, are we consistent with community experience and expectations? Does the community have the will to take this on? If we want to take on that there's a lot of law enforcement in certain areas in town, we want to build more smoke-free areas and pass more smoke-free ordinances. Does the community have the will to take this on? Is this something that, within our expectations, this is going to be a strategy that will work for our community at this point in time? There may be other issues in the community that are more pressing, and it may not be relevant to take on those conditions that require an ordinance change at this point in time. So these are all valid considerations in moving from that brainstorm list to a more focused logic model. When you do that, you're able to develop a logic model, which we use what here is a 2x4, meaning we have 2 root causes and 4 local conditions. And you can see we've identified, just as examples, 4 different local conditions for the root causes: favorable attitudes and availability. And so again, if liquor stores are selling tobacco products as well, when we address those liquor stores, looking at the 3rd one down, we're not only going to be addressing tobacco issue, we'll also be addressing the underage drinking issue. So there will be, and this is a benefit, multiple benefits from addressing some of these strategies, addressing some of these local conditions. And not only do we want to make sure that the local conditions are specific, identifiable, and actionable, meaning it's a behavior we can do something about, we also want to make sure that we have data associated with it. For multiple reasons, as I mentioned earlier, also is when we go up before, say we want to pass an ordinance, and we go before City Council, and we want to pass an ordinance maybe toughening the fines for retailers that are selling tobacco products to minors. I guarantee you, your City Council or County Council will ask, how do you know that's a problem? And so that is all the more reason why we need to have data, so we can say, here's what we found. We've looked at surveys, we've talked to people, we've got compliance checks, we've got a range of data that says that this particular issue is a problem in our community. So we wanted, the way we like to frame it, that you have at least 2 pieces of data for each problem statement, each root cause, each local condition. We want to look at both qualitative and quantitative data. And we need to be able to collect it multiple times, meaning that we're using the same data not only to drive our strategies, but also for evaluation purposes. We come back in 6 months and a year after we've done compliance checks, after we've trained our retailers, then we do a second round of compliance checks, then we can say, have the number of retailers selling to young people decreased? We can use the same data as part of our evaluation. So it is important that we have data on our logic models. So at this point, just like to show you an example, and this is in your workbook as well on page 3. This is from an actual coalition. And you can see they've done a fairly big effort. They've used more. They're using what is this? This is a 3x6 logic model. They've identified 3 root causes for youth under 18 using tobacco, and then a total of 6 different local conditions. And so as you can see here, they've identified data for each of those, and they've provided a lot of detailed data around each of the problems, root causes, and local conditions. So what I'd like you to do now, if you can, and if you want to, you can go ahead and pause the webinar. Is just take a look at this logic model. That does it meet our criteria? Does it meet, so do we have data from multiple sources? Does the data represent the measure, the root cause, the problem, the local condition? Are the local conditions specific, identifiable, and actionable? Meaning, can you picture that situation in your mind, and is it something we can do something about? And then also, just start to think about, if this was your logic model, how might you improve this, or what recommendations you would make to improve this logic model. So if you want, now is a good time to pause. On page 4 of your handout, there's a template for the logic model as well, if you want to use that for your coalitions. So after you've had a chance to look at your logic model, these are just some basic observations that I've made for our discussion purposes here. First, under the basic problems, root causes, and local conditions are generally good. There's good detail in each of those. The first thing that we have identified under the problem statement, the first two pieces of data are good that talk about the average age of use is 13.5 years old, and that 10.5% would want to know who that is, have smoked cigarettes in the last 30 days, and 11.8% have used chewing tobacco. So I would want to know what age group that is. But that's good information. That tells us, okay, what is the extent of tobacco use in our community? The next two pieces of data, they think it's not at all. What 37% say they think their peers find it not wrong at all, or 11.7% say they think their parents find it not wrong at all. Those are actually data that measures favorable attitudes. So those would not be the best measures of the problem itself. If they were to have prioritized the root cause favorable attitudes, that would be data for that. That'd be one observation that I found. Another observation is that their local conditions, if you look at the local conditions, they're good. They do describe behaviors. In order to really understand, and you'll see this when we move to developing strategies, you really want those local conditions to be real specific. So, but why here, but when here, but why how often here, but by where here. So if you look at the second one from the bottom, looking at the logic model, the second one from the bottom, I'm going to go back to that slide, where it talks about use of smoking and using smokeless tobacco throughout the community with no legal consequences. That's a behavior which is good, and it's something we can do something about. It would be nicer to even make it more specific to find out where. So when you talk about in law enforcement, if we're going to develop strategies that involve more enforcement, we need to find out where. Is it on school property? Is it around parks? If it's on private property, if it's around businesses. So each of those tells us where we'll intervene, what laws may be appropriate, who will be involved in the intervention, who we can involve in the strategies. So that's just one example of how we could be more specific about this. The one right above that, the local condition, youth can access tobacco at unlicensed establishments. I would like to want to know a little bit more about who and where those unlicensed establishments are and why there's no consequences. If we know those exist, I would want to find out why nothing is being done about them. That's really just getting more detail that really allows us to develop very specific strategies to address those local conditions. And then the third comment I would make is that the data generally are quite good. They're using multiple data. They're using multiple sources for each element. And so we have a good understanding that they know what they're talking about. They didn't make up these problems, root causes, and local conditions. And it gives us confidence as a community that these exist and that if we address them, then we will have an impact ultimately on youth under 18 using tobacco. So that's a summary of our logic models. It's really important to really just make sure that the community is involved in developing these, the community can understand these, which really is our roadmap, as you'll see, for developing specific strategies. Which moves to our next piece, which is the last portion of this, which is where we can say once we've got our roadmap, once we've started to identify what are those conditions in our community, then we can start to say, okay, let's develop strategies that can target those. And so this is where one of the key points here is that when we develop strategies, we develop a set of strategies, and we call those comprehensive strategies, for each local condition. So the coaches are chewing at high school football games, parents are smoking with their children, the stores are not carding, youth are sharing their tobacco at school. While there may be some strategies that overlap, we still want to, in our planning, look at each of these individually to say, what will it take to change that particular behavior? So when we look at coaches chewing at football games, if we just provide information that's illegal, it's in violation of school policy, if we only provide information, we know that information alone only goes so far to change behaviors. So we need to have other strategies behind it. So we're going to look at what is that range of comprehensive strategies we want to put in place. And just as a reminder, as we start talking about the strategies, keep in mind that some strategies are targeted toward individuals, and these a lot of times can be provided through our partners, our service providers, our schools, our faith community, through family service providers. These are the types of strategies where it's information or curriculum provided to youth or to parents, or counseling programs, or individual cessation programs, or ESPERT, which is screening, brief intervention for referral or treatment. Those sorts of things are really targeted toward individuals. And those are one of the types of strategies we want to put in place. The other are those environmental strategies that target that shared community environment. These are such things as policies, whether it's laws or ordinance or internal policies or changes to systems. And we'll look at these. These are strategies that when we impact them, they impact the whole community. So the whole point is, as we develop these comprehensive strategies, we want to look at a range of strategies. And so let's take a little bit more time to look at what are these environmental strategies. And so environmental strategies and these are important because when we talk about we want to input change that are going to occur and last for a long time, the environmental strategies are really an advantage because if we put a new law in place and that law is enforced, regardless of who's mayor, regardless of who's on the council, regardless of who's at the law enforcement agency, that law is in place. And so we know that there will be mechanisms to enforce it. With some of the individual strategies, if we provide education, well, there's always going to be a new class of young people coming in. There's always going to be a new class of third graders, of fourth graders. And so we will need to continue that all the time. And so that's why we really want to look at those environmental strategies which are long-lasting, that change the community conditions, that change standards and institutions. If we find out that law enforcement are enforcing and they are issuing citations to young people for using tobacco products, but the courts aren't doing anything, then we may change our systems or our policies or institutions so we can provide, not necessarily fine young people, put them in jail, but make sure they have appropriate access to services, make sure that their parents are being held accountable for their working with their children to address the situation. Again, we want to look at a range of strategies that help change that community environment around the particular behaviors. And so just some examples of these environmental strategies. You'll see many strategies here. Some of you, I'm sure a lot of you have many of these strategies in place. And so one of the challenges, some people when they want to do prevention, they want to jump directly to here and say, okay, let's just pick some of these strategies that we're not doing. And the whole point is there's a lot of different strategies we can put in place. When we look at our logic model, that tells us, okay, what is it specifically in our community we want to change? Then we can identify specifically which strategy will be the most effective strategy at changing that local condition. And so fortunately in the tobacco world, when we talk about evidence-based strategies, there's a lot of research out there that has been done on these individual and environment strategies. So by many of the agencies that fund our efforts, there's a lot of research done. And rather than trying to provide a whole range of sources, one of the best sources is provided by the National Institute of Health. They've got an evidence-based programs and practices, and the website is listed here. If you just do a Google search on NIH, evidence-based programs and practices, it's a wonderful resource that points you to other places where you can get evidence around tobacco and other drugs. You can provide evidence around effective strategies. The point is we don't have to make up a lot of our strategies. Our challenge as a coalition is really to move to look at our logic models and say, okay, what range of strategies, what comprehensive set of strategies we want to put in place that will change that local condition. So as you can see here in just this very simple example, if coaches are using chew at high school football games, then when we talk about a range of strategies, we can provide information to school staff and remind them of school policy, remind them of resources that are available that if they do want to stop using the tobacco product, there is support for them. We want to provide training if we know the coaches are inconsistent in their monitoring and their own use of their own, and let alone the student athletes, then we can target specific training for coaches. We can make sure that they have availability of cessation resources. We can make sure that we have services on the school campus available, depending on the school, that are available to students and to adults so that they can get access to those services they need. We recognize those coaches that take positive steps toward either addressing their own youth or providing real clear guidelines for their student athletes around what is not acceptable, what is in violation of school policy, how that will be enforced. We can recognize those coaches that do that. We can post signs all over the field in our athletic facilities around tobacco and tobacco use. And we can make sure that we have a good, strong school policy and that we can make sure that that school policy is enforced with appropriate consequences. And again, this is our example here was CHU. A lot of times now, a lot of school policies may not be specifically written to address vaping. And so we can really use this as an opportunity to revisit if that was our local conditions, that there's vaping going on school property, then we can use that as an opportunity to revisit our school policies and say, how are we going to address this new situation? So the point is if we just provide information or we just provide training to coaches that may or may not address the entire problem, but when we address all 7 of these strategies and these types of strategies, then we can have confidence that we'll be able to address this one local condition. And so the point here is we want to be comprehensive in addressing a local condition, and then for each of, in this example, 3 other local conditions, we want to go through the same process of identifying what are those strategies that can be used to address these local conditions. And so as you notice, we went through 7 strategies, and there are what we call 7 strategies for behavior change. And what we'd like to say is these are good considerations for us to think about as we're addressing our local conditions. We may not do something related to every one of these, but let's at least be mindful and thoughtful about each of these. And there's a real nice handout that's provided for you on the website. The CADCA has gone through for tobacco and identified just some examples pulling from different coalitions, communities we've worked with, some examples of each of these types of strategies. And so what's nice is when we have a local condition in mind, we can go through a list like that or others and say, okay, based on resources we have in our community, what will be the best range of strategies that we can use to address our local condition? So just summarizing these real quick, providing information is letting people know about the harmfulness of a problem, letting them know what laws are in place, what are the consequences of those laws. Building skills is giving people the skills to do what they want. It may be skills for coaches to talk to students, maybe skills for law enforcement to do compliance checks, it may be skills for parents to have conversations with their children. Providing support is how do we make it easier for people to do something. So we may be able to support law enforcement in doing those compliance checks. If we're going to be talking to coaches or school staff, can we make it easier for them to get access to their EAP, their Employee Assistance Program, or to cessation services, as an example. Another way of looking at this is how do we change access or barriers? How do we make it easier for people to access things we want or harder to get access to things we don't want? And a very good example of this with tobacco is a while back we moved all tobacco products behind the counter. And so that created a barrier for young people and adults getting access to tobacco. Now some retailers skirt this by having singles on the counter, which make it easier access, so we can look at that. If that's our local condition, then we can address that. Consequences is positive and negative. How do we reinforce those behaviors we want? How do we recognize coaches that are taking advantage and really providing clear guidelines to their player athletes? And what are some of the negative consequences? Typically these are fines or some sort of, I don't want to say punishment, but some sort of consequence for violating a law, violating a particular policy that's in place. Physical design, again, is another way of looking at putting tobacco products behind the counter. We've made it physically harder to get those products. It can be putting up signage around different places, all depending on maybe putting cameras. If we know youth are smoking at certain places or adults, we can put up cameras in certain places to monitor that. And then changing policies, rules, practices, procedures we need to have new law in place, or it may be just law enforcement procedures so that they can enforce the specific locations that we've identified. It may be some of the practices, maybe budgeting, just getting groups to allocate some of their resources toward these strategies. So it can be any types of policies that support the changes to behavior related to the local condition. Just walking through an example of that. This is looking at a local condition of retailers selling to minors. And so we can provide, and you can read through this, but we can provide signage. We can train the merchants to check IDs. We can support, provide assistance to the merchants. That may be making sure that they have access to all this training. We can provide them with mats that have the IDs on them and signage, which is down below. Or we may just whatever it takes to support and encourage the retailers to check IDs. If a lot of our retailers may not speak English or the clerks may not speak English as their primary language, we can provide education in appropriate languages. We maybe want to recognize those sellers that do comply, and we may want to increase the fines for those that don't comply or require that they do more server training. Physical design, place products behind the counter. We talked about that. It may be signage we put up. Another example of physical design I always think about, in one case, students were, after high school football games, they're smoking and drinking and doing other things behind the tennis courts after the football game. So what that school decided to do was water the lawn behind the tennis courts after the football game. That was a physical design change that literally changed that behavior. They may move somewhere else. Then we can look at strategies to address that location. All we're doing is we're making youth more aware of what they're doing is harmful to themselves and risky behavior, and we're making it harder for them to do it. And then finally, policies, we can increase compliance checks. That's a policy change, or we may need to change the law to increase the fines. The point is, if we just provide information or post signs at the retailers, we don't tell the minors, that's not necessarily going to change behavior. When we do all 7 of these strategies, then that's going to put a lot of pieces in place that will encourage across our entire community that these behaviors are changed and that retailers are not selling to minors anymore. So that's an example of a comprehensive strategy. And so we've just provided an example from a community. You can see the key point with the example. This is in your handouts on page 5. There's a template for this document on page 4. But you can see they have in each of the categories, they have multiple strategies. So you can see under providing information, there's lots of different places that they're providing information to. It's not just to one group. And so under providing skills, they may be providing skills to young people, to the store owners. So it's a range of strategies under each. It's not just one. Here's an example where we don't want to be limited by the size of our boxes. So again, it's how do we think comprehensively around changing any one local condition. And so we do encourage you to go out to, CADCA has the Prevent Tobacco Use Toolkit, and you can see the website below. It's www.preventtobaccouse.org. They have a list of the 7 strategies. They have a lot of other information out there that can support you in, again, identifying what comprehensive strategies can we put in place to address a given local condition. And so just as a summary for this piece, and again, this is really the rubber hitting the road, how we're moving toward addressing those local conditions. We ask that coalitions, that people who are engaged in this effort, consider all 7 strategies. You may not do all 7. There may not be a physical change to make, but let's at least consider those. Multiple strategies or actions within each of those that complement each other. There may be multiple target audiences for any given set of strategies. We also recognize that we're not going to start doing all 7 strategies at once. There may be some if we're going to be passing an ordinance, that may not be a year and a half down the road that we actually get to the actual ordinance. What are the things we need to do before then? What information do we need to provide to get the community behind the effort? What sort of steps do we need to take? So think about sequencing these strategies in an appropriate order. And then finally, here's one important piece is focus on changing the local condition. A lot of times we find that coalitions or people will say, hey, let's do this. We've been doing this. We want to do this. It's a nice strategy, but does it really change that local condition? And so we really want to keep the eye on the prize, which is for each local condition, consider what are these comprehensive strategies we can put in place. So given that, the last thing we want to do is just spend a little bit more time talking about the last strategy, which is changing policies. And what we talked about, and this comes from, I mentioned in a training earlier, and we're just going to refer to this, and through CADCA technical assistance that we'll provide at the bottom, there's a lot more information to put in place, just to recognize that if we're going to put a new ordinance in or do policy change, that's a very complex and effort-based process. And so we've identified 10 policy development steps that you can use to put in place a policy change. And so one of the first steps, just quickly to mention this, one of the first things we want to do is identify if we want to put a new clean air law in place or make a certain part smoke-free, tobacco-free. If we want to do certain policy, we need to find out where's the best level to do that policy. Is it at the home? And this all depends on your local condition. Is it the home, the neighborhood? Is it institutional? Meaning we're going to ask if the local condition is smoking outside public buildings. Then it may be institutional. Each of those businesses, each of those public buildings will need to develop their own policy. Is it a city policy we want to put in place, a county policy? Is it a state or a national policy? So we want to be looking what level. That tells us who we need to involve. It tells us what sort of strategies we need to put in place. And finally, we want to look at both what we call big P and little p. And this is just a way of thinking about policy. Big P are those policy changes that will require an elected body to vote on. So our city council, our county council, our school board. That requires a level of sophistication and effort to get it on the agenda, to have it go through all the policies and procedures, the process it takes to get an ordinance put in place. So that requires a certain level of effort. And then small P's are those policies, are those procedures and practices. Again, if law enforcement is going to change when they do compliance checks, or if the school district is going to change how they follow up on people who are in violation of their tobacco policies. Those don't require a vote of the city council or the school board, or they may not. They can be changed a little bit more easier. We still need to go through a thoughtful process of planning for those particular changes. So in looking at the 10 policy steps, we're not going to go through these. This webinar will end at some point. Not to go through these, but the point is to know that there is steps to go through. When you look at the first 4 steps, and I can say this, I'm from Oregon, this is about getting your ducks in a row. So we really want to state what is the local condition we want to put in place, and we talk to whoever's going to be enforcing that local condition. That's why that but where here is important. If it's on school property, if the local condition occurs on businesses, on public parks, on private property, we need to know who's going to be enforcing it, and we need to engage them early on. We want to be able to gather data so we can know that A, that local condition exists, B, that the policy we're proposing is going to be effective at changing that. When we're able to do that, then we can research what policies are going to be best for us, and we can create a local condition. So this is the one that's really critical. Before we move forward with drafting policy and getting it on the agenda and getting people to support it, we want to make sure that we've identified, based on our knowledge of the local condition, what is the best policy, and will this policy actually change the behaviors that we want. So one way you can go about summarizing all your work in that vein is to put together an issue brief. And an issue brief just gets our arms around what is this policy we want to change, what is the problem, how do we know it's a problem, what are the proposed solutions, how do we know these proposed solutions work. And so there's various examples of issue briefs out there. I found one. This is an interesting one from Texas Standing Tall, but it provides a nice summary of a statewide, but they're trying to do clean air ordinances statewide. So it summarizes what is the problem, what are some of the consequences that we're seeing, what are some data that we have. Then it starts talking about what is the solution, what is a clean air law, why do we want to put that in place. And so there's a lot of information here. This way, when we go start talking, and this can be used at a local level even, to say, hey, all these counties have already adopted it. Here, why wouldn't we adopt it here in this county? These are some of the benefits. These are some of the data that's related with the problem. And so you can develop an issue brief such as this around your local level, where you're putting your local data you collected from your assessment in and saying, here's our problem. We've done research to say, here's our proposed policy solution. Here may be some other local communities that have already adopted this with these effects. Here's why it's important for us to implement this in our community. That issue brief really allows us to then, once we have our ducks in a row, then we can go forward and start engaging lawmakers and community members and getting that grassroots organization in place in order to get the policy passed. So that's why, again, all this ties together, starting all the way back with our community assessment. We understand what's happening in our community. We prioritize through our problem analysis. We identify which areas we want to focus on through our logic model. And then with our strategies, we're allowed to really, what is the comprehensive set of strategies that we can put in place to change any local condition. Depending on the policy, we can develop an issue brief that really allows us to say, here's the problem, the local condition, here's what we're going to do about it, here's why we need your support. So that's a long way through our moving from our community assessment, problem analysis, logic model, comprehensive strategies. And some people may ask, well, how long does this take? And this process can take anywhere, depending on your assessments, from 2 to 3 months. Some coalitions can take 6 months. If it's a big issue in their community and we want to get a lot of community support, it can take longer than that as we're engaging more and more partners in coming up with this logic model and targeted strategies to change specific local conditions. So with that, hopefully from this webinar, you'll be able to say some of these elements may be important. You may be at certain places in your planning, but hopefully you can identify which of these concepts are relevant to your organization, and then what are some of the next steps about engaging our coalition members and taking some action based on, as appropriate, what you've heard here today. And final piece here is just to let you know that there are a lot of resources available. Keith is going to come back and talk more about this. But there's a lot of resources available from CADCA and from within your state to be able to support you in your efforts. So at this point, I'm going to say thank you very much. Hope you're continuing to have a beautiful day, and I'm going to turn it back over to Keith.
Thank you so much, Dave. We really appreciate your expertise and the time that you invested in providing the technical assistance to our partners in Iowa. We appreciate here at GIA the opportunity to share our experience and expertise with our Iowa partners. It is our hope that the technical assistance that Dave has shared over the webinar series translates into executable action steps that you all can do that aligns with your realities and aligns with your tobacco control agendas. If you need any additional insight or have any questions, or if you just need more information, please contact us directly via the avenues shown on the screen here, or you can reach out to your contact, Glenda Prior, within the Iowa Department of Public Health. Once again, thank you so much. Glenda Prior, within the Iowa Department of Public Health. Once again, thank you so much. Glenda Prior, within the Iowa Department of Public Health. Once again, thank you so much. Glenda Prior, within the Iowa Department of Public Health. Once again, thank you so much.